Good evening to everyone. We are certainly grateful to God for all the blessings that God has given to each and every one of us. We are grateful to God that you've decided to join us in this virtual space tonight for this virtual town hall as we discuss the vaccine, some of the misnomers, some of the misconceptions. We really want to place trusted voices and trusted spaces and bring to you this moment of clarity and refreshing, hoping and trusting that you will make a decision concerning vaccination. And so as we have gathered here tonight, we have gathered to talk and to share with some medical professionals, those that work in the healthcare field, that will be sharing with us some things concerning vaccinations and concerning this particular vaccination, because it is imperative that we all gain clarity and more information on what's happening in our world today. I know that for many of you and for many of us, we often look across our social media pages and find so much information concerning COVID-19 and concerning becoming vaccinated. And we wanted to bring to you an opportunity to share with some medical professionals and to talk with them and to have an open dialogue. Those who are watching on Facebook, those who are watching us on YouTube right now, you will have the opportunity. We are watching and monitoring the chats. You have the opportunity to pose questions that we can then bring to our medical professionals who can also help us tonight as we engage in this moment, in this space. I'm truly excited. About this because I think it is imperative for us to gain more information and to gain clarity on this particular illness, COVID-19, because we have already to this point, over the last 20 plus months, lost so many. And I think that it's important that we hold up this vaccine as a way to prevent the loss of so many more. I'm hoping that by the information you gain here tonight, that you will have a more powerful understanding of what COVID-19 is doing within the local community, but also how you can better help to aid the communities here and wherever you are, that we might put an end to this devastating illness. We have some of the brightest medical professionals here tonight. This is all being brought to us by several different groups and entities that have come together. The Star Network, New York State Health, the Pilgrim Baptist Church, the Grace Baptist Church of Mount Vernon, the Congress of National Black Churches. We are just so grateful to God for all of them coming together and pulling this together that we might inform our communities to make informed decisions and not misinformed ones. Please keep in mind, you can go on to as you're on our Facebook and YouTube channels, we are monitoring our chat, so if you have any questions as they come forward to share with you, please feel free to do so. We will make sure that those questions get to them and that they will be answered in real time on screen. Amen. I want to thank immediately Marcy McCall, Dr. Suzette Oyeku, and all the others who have come together, Reverend Sheila Simmons of the Grace Baptist Church, who helped put and plan this event tonight. I want to thank all of them, all the various sponsors who are present, all the various sponsors who are taking part in this initiative. As we are having the town hall tonight, we are also planning for a pop-up vaccination site tomorrow, as well as a health fair. And so we want to make sure that people have information concerning vaccinations so that they can make a decision to hopefully come and get vaccinated with us tomorrow. All right, I'm going to turn it over to them now. And they are going to each come to you in their own way. And I believe it's going to start tonight with Dr. Oyeku. God bless.
Thank you. Good night. Thank you so much, Pastor. And thank you all for joining this evening. I just want to go over a couple of housekeeping things. So for those that are participating in the virtual town hall, your lines will be muted. If you're on Facebook and YouTube, as Pastor said, your questions in the chat will be sent to us and we'll be able to respond. So our roadmap for tonight's town hall is we're going to just introduce our panel. We're going to talk a little bit about open enrollment in terms of insurance. We're going to share some updates around COVID and then also vaccination updates. We'll talk about the upcoming pop-up vaccination, and then just briefly talk about mental health resources, the flu, and then get to answering your questions and wrap up. So Pastor has already, kicked this off, and I wanted to introduce Marcy McCall, who's from the New York State Department of Health, and part of the vaccine. She's the vaccine team statewide director. So, Ms. McCall, do you want to say hi?
Good evening and welcome. I'm glad you all made it.
Thank you so much. And then we have Mr. Johannes Chemwen. No, but you're going to correct me because I think I said that wrong. But he's the CEO of the VIP Star Network, a very trusted partner. So Johannes, if you want to first correct my pronunciation of your last name. Sorry about that. Oh, you're on mute.
All right. No, I wanted to say welcome and thank you everybody for joining tonight's town hall. It's actually you had it right, Dr. Suzette. Chem Wayne no, right?
Oh.
So all coming together, it's Chem Wayno. And so I'm happy to be here and make sure I'm a resource to the group and the community. Thank you so much.
Thank you so much. So I'm going to pass it over to Ms. McCall, who's going to get us started and talk a bit about open enrollment.
Well, good evening again, everybody. Really, really glad to be here and to participate in this very important discussion. The one thing that we all want you to do is we want you to have every tool in your toolbox to help keep yourself and your family healthy and safe. And health insurance is one of the primary ways to do so. If you are a person who does not have health insurance or has lost health insurance due to the pandemic, New York State of Health Marketplace is here to help you. Our open enrollment season, which actually has been all year long because of the pandemic, but it officially kicks off in November. So we just want to go over a couple of things to, again, let you know about what we do and what we have to offer. So it's one-stop shopping for subsidized and unsubsidized coverage. You can easily compare health plan options, free personalized enrollment help, the only place to check eligibility and apply for financial assistance, enroll in qualified health plans, Essential Plan, Child Health Plus, and Medicaid, available to all New York State residents who are lawfully present. Next slide. So what's covered under these plans? All plans have the same core benefits: free preventive care, inpatient care, outpatient services, maternity and newborn care, emergency services, lab and imaging, prescription drug, rehabilitative and habilitative services, mental health and substance abuse disorder services, wellness and chronic disease management, pediatric dental and vision. Adult dental coverage and other benefits may also be available. Next slide. So the American Rescue Plan was signed into law on March 11th, 2021. This enhances tax credits for those that would like to utilize them. And not to go into all of this text, but the bottom line is this can cut your premium costs in more than half. So it's worth looking into to see if you qualify for it and you will be able to utilize this benefit. Next slide. So how to enroll? Enrollment assisters are available in every one of our counties in New York. You can make a free and personalized enrollment appointment. I'm sorry, this is New York City and, well, sirens. I apologize. They'll be gone in a sec. I hope. There we go. So we're located in every county. You can make an appointment for free personalized application assistance. Assistance is available in 38 languages. You can find the enrollment assisters on our website. And actually, the quickest way to do it is to go to nystateofhealth.ny.gov. Click the resource tab and scroll down to assisters. We also have a customer service center, which is open Monday through Friday, 8 a.m. to 8 p.m. and Saturday, 9 a.m. to 1 p.m. The phone number is 855-355-57 877. We have assistance in all languages as well, and you can complete an application over the phone. The website, once again, is nystateofhealth.ny.gov. And you can complete your application online yourself. You can compare plans, and you can also utilize the doctor and hospital lookup tool. In this tool, you'll be able to find if your doctors are in what networks and what plans, and also play around with the calculator to see what type of assistance you may qualify for. So thanks for listening. And again, this is just one more tool to put in your toolbox. And now I'm going to kick it back to Dr. Suzette.
Thank you so much, Ms. McCall. So now we're going to talk a little bit about COVID and then shift to talking about COVID-19 vaccines. Oh, sorry, before we get to that, I'm going to have Johannes actually walk us through, because I think it's important framing for you to understand the role of CDC, FCA, and Department of Health. So Johannes?
Yeah, thank you so much for that, Dr. Suzette. And so one of the things about our ability to help the community understand the roles of the governing agencies and organizations is to better identify and define what those organizations do. So the FDA, also known as the Food and Drug Administration, is responsible for protecting the public health by ensuring safety, efficacy, and various security measurements are in place when pharmaceutical manufacturers, drug agencies, as well as medical device and food organizations submit their applications through a very stringent process. And so some of the information that has been in the community and maybe almost misunderstood is how did we kind of expedite, and I say we as in the community as a large, expedite the process for the applications when it came to the vaccines themselves. And so the FDA administers and oversees that entire process and works directly with the manufacturers to ensure that applications are submitted in a way that meets the requirements by the agencies in terms of their goals for the public health. And after the FDA receives those applications from organizations such as Pfizer, Mrna, as well as Johnson & Johnson, they then review that information through a very stringent process and communicate and orchestrate that process directly with the CDC. And one important fact that a lot of people don't know is the Food and Drug Administration was actually founded by President Theodore Roosevelt, as well as Harvey Washington Wiley, a long, long time ago. So they've been in coordinated with the White House and various government agencies for a long time. After they administer and oversee the process from the FDA as well as the CDC, then they directly correlate those messages as well as the various information with the Department of Health with the state of New York. And so there is a hierarchy there that is administered in a very stringent process, a stringent way, and they correlate every program that's administered from that high level to the lower level in terms of how the states interact with those governing agencies. And so I wanted to make sure that we helped the community understand exactly how that process works. The CDC also helps understand the public health's very important initiatives on a larger basis. They work directly with the World Health Organization to better understand what type of viruses are coming up and that we should watch very closely. Thank you so much, Dr. Suzette.
Thank you so much for that important frame. And with that, we're going to now talk a little bit about COVID-19. So where are we now? I think we've been all dealing with COVID-19 for the last close to 20 months. So just want to remind all of us in terms of many of us have been touched by this infection, either personally or through having a loved one be infected with the virus. But I wanted to just go over what the symptoms are. So it's fever or chills, cough, shortness of breath, feeling tired, headache or body aches, loss of taste or smell, sore throat, nasal congestion, nausea, vomiting, or diarrhea. Other symptoms that are more severe and would require emergency service, emergency care are difficulty breathing, persistent chest discomfort, confusion, lethargy, or even noticing changes in the color of the lips or the face. These all things warrant you going straight to the emergency department. Other complications of COVID-19 include, there are many, and we know that the virus can infect pretty much every single organ system, from the brain causing the headaches and the loss in taste and smell, but can also lead to stroke. can also impact the kidneys as well as the liver. The GI system, many people experience very terrible nausea and vomiting. We know that there's increased risk of blood clots as well as cardiac disease, so particular irregular rhythms or also inflammation of the heart muscle called myocarditis. And then also changes in the blood sugar in terms of elevations in the blood sugar. And for people with diabetes, that can make managing their diabetes difficult. We also know that some people can get various rashes on their body related to having COVID-19. Recent analyses have shown that symptoms of COVID can persist, and it's something that we call long hauler syndrome. And we know that people who've had COVID and recovered, maybe it's still at increased risk of long-term complications and also death 30 days and 6 months after having COVID-19. So this is not an infection to play with. In terms of long hauler syndrome or post-COVID syndrome, these typically, these are symptoms that persist 4 weeks or longer after having your initial COVID infection. And these can severely impact somebody's ability to function and perform their daily activities. So they can experience the loss of taste or smell, shortness of breath, cough, the increased risk of blood clots, memory loss or confusion. They can just feel like they're in a fog, fatigue, hair loss, joint pain, blood circulation issues, vision issues, skin rash, dry eyes, and sleeping difficulties and dizziness. So a lot of different complications. And we know that, these are important. I wanted to say a word in terms of testing options just because, just so you know the distinction. So there's viral tests that you can do to see if you've had a current infection with COVID. And so these are nucleic acid amplification tests or PCR tests. And then there's antigen tests. There's also an antibody test that you can get to test if you've had a past infection. So just wanted you to know in terms of the distinctions between the two. In terms of where are we right now? So actually we're starting to see a downturn in the number of cases here in the United States, but it still has impacted a lot of people. So globally, over 236 million people have had COVID-19. And in the US, close to 43, almost 44 million people have had COVID-19. And across the globe, close to 4.8 million people have lost their lives. And in the US, we topped over 700 people dying from COVID. So this is definitely, one of the worst illnesses that we've seen in terms of this country here in the US. In terms of the cases, so when I've given this presentation recently, the cases were topping close to 1 million cases a week. Thankfully, the number of new cases in the past week are starting to trend down, but they're still pretty high, 655,000 cases. And when we look at the parts of the U.S. that have the highest proportion of the cases, you'll see these are the darker blue-hued states. You'll see in Florida, Texas, California, parts in Virginia, and in Pennsylvania and Ohio. These are areas that are impacted. And we know that this, if you layer on the map in terms of vaccination, we also see that this is in areas where there's significant populations of people that are unvaccinated. We also know that over time, so when this pandemic first started, it was primarily the Alpha variant. And now we're starting to see that predominantly the cases are all the Delta variant. So 99.8% of the cases in the United States are due to the Delta variant. They have been monitoring the Mu variants, but it's actually, less than, it's a very small percentage. It's less than 0.1%. The Delta variant is concerning because it has increased transmission. It's more contagious, and people are at higher risk. Those that are unvaccinated are at higher risk. We know that this variant spreads easily in indoor spaces. So when people are unmasked and unvaccinated, there's a high chance of spread. So this was a recent analysis that was done, and this was an adult who was occasionally unmasked, who was infected with the COVID, with the Delta variant, and worked in a classroom for 2 days. They subsequently, in turn, infected 12 out of the 24 kids in that class. So this is definitely concerning and just highlights the high chance of spread from the Delta variant. But thankfully, the cases are starting to trend downward. So just a couple of weeks ago, we were peaking close to 2,000 cases, 2,000 people losing their lives daily due to COVID. And now we're starting to see that number starting to trend down. We're still over 1,000 individuals dying a day from COVID, but thankfully the curve is going in the downward direction. So this surge hopefully is starting to abate. When we look in terms of COVID-19 vaccinations in the U.S., there have been over 400,000 vaccinations that have been administered so far, and about 65% of our U.S. population has had at least one dose of the COVID vaccine. And then when we look again at that map of who, the percent of people who received at least one dose, you see that the darker color blues are the states that have had high proportions of individuals receiving at least one dose of the COVID vaccine. And then the lighter green colors are those states that have lower percents of people receiving at least one dose. And so you see that in the South and in the Midwest, there's great opportunity for us to enhance vaccination in these communities. Just a word in terms of vaccine breakthrough infections. So these are defined as the detection of the SARS-CoV-2 RNA or antigen in a specimen collected from a person greater than 14 days after they've completed all the recommended doses of that COVID-19 vaccine. And what you can see here in New York State, so this is New York State cases and hospitalizations, and this is by week. And what you can see here is the red line are people that are fully vaccinated. So you can see that the fully vaccinated individuals are a lower proportion of the cases versus those that are unvaccinated. You can see that the majority of the cases are in unvaccinated individuals. This is adults. And then you see a similar pattern for hospitalizations, where you're seeing that the higher proportion of hospitalizations are among adults who are unvaccinated. When you look at New York City, you see a similar curve in that the proportion of cases as well as hospitalizations are among those that are unvaccinated. So this pandemic has really shifted more to those that are unvaccinated, and hence why we're coming to speak to you tonight. And in terms of NIAC, where you guys are, there are 18 active COVID cases as of today. And in terms of the numbers of doses that have been given, about 15,000, a little over 15,000 doses have been given. When we look at the percentage of the population who received the first dose, it's close to 53%. And then the percent of the population who received the second dose, it's close to 46%. So there's still opportunity in terms of the population to definitely have higher rates of vaccination in the NIAC zip code where the church is located. Just a word about children. So we know that over the summer, we noticed that there was incremental rise in the number of cases of children with COVID. And they actually represented about 25% of the cases in the United States. And the preponderance of those cases were in the South. And so this is, also aligns with those areas that are, have significant under-vaccination. When we look at in terms of the risk for COVID infection, hospitalizations, and death, we see that people of color are at higher risk for hospitalization as well as death from COVID-19. And our American Indian and Alaskan Native brothers and sisters are also at higher risk for hospitalization and death from this illness. And it's not so much about specifically race, but it's more about other underlying conditions that may affect their health. So they, in terms of socioeconomic status, their access to healthcare services, and then the exposure to the virus due to their occupation. So particularly either being a frontline worker, central worker, or critical infrastructure worker. A word about masks, and mask guidance has changed, but this is the current guidance. It's definitely, people who are not fully vaccinated should be wearing a mask. If you're fully vaccinated with the weakened immune system, you should wear a mask. And right now, because many areas, including New York State, have substantial or high rates of transmission, it's recommended that you're fully even if you're not fully vaccinated. If you're fully vaccinated and you're unvaccinated, that you wear a mask, even if you're indoors. So, and that's because there's high rates of transmissibility in our communities, and so we know that wearing masks work. We also recommend when people are outdoors in crowded settings for people to wear masks. And just a word in terms of the mask that people should wear is definitely one that has 2 or more layers of some sort of breathable fabric, that it covers your nose and your mouth, and that it fits snugly so that there's no gaps. We do not advise you wearing the ones that have the exhalation vents, because that will only allow the virus particles to escape, and that's not what you want. Just a cartoon to show you kind of the impact in terms of, wearing masks and what they can do. So you have somebody who's infected, but they're asymptomatic. If they're just talking or coughing, these are all these respiratory droplets. And you see somebody wearing a mask, you can see how many respiratory droplets are spewed. But if you have this person who's infected and they're wearing a mask, you have very limited aerosol airborne transmission of the virus. So masks do help, and they're really, really effective. Other strategies beyond wearing masks are maintaining social distancing, washing your hands, using alcohol-based hand sanitizers, other preventative measures like making sure that we're eating healthy, exercising, getting adequate rest and sleep, staying home if you're sick, getting tested for COVID if you are feeling sick, and then getting vaccinated. Just a word, and if you have a camera, you can put your camera, open up your camera, and you can put the QR code to the screen, and you can take a picture, and it'll take you to this website. This here is just the management guideline for those that are not hospitalized in terms of adults with COVID. And I bring this attention because I want to let people know that currently for adults with COVID who are not requiring hospitalization or supplemental oxygen, that they may be offered something called monoclonal antibodies as a way to kind of shorten their course of symptoms with COVID-19. Now, it may not be available at every location, but it's important for you to talk to your doctor because this may be available, and this we know can shorten the course of symptoms for individuals. For those that are hospitalized, and it depends on if you're on oxygen or not. If you're hospitalized but don't require oxygen, then doctors may offer dexamethasone or ticagrelor. If someone requires oxygen or mechanical ventilation, then they may offer additional therapies such as anti-inflammatory medications or immune modulator medications. So I wanted to just let people know that there are these new therapeutics that are available to treat individuals with COVID. So you can put this QR code, you can take a picture of it and save this and let your family and friends know. I just wanted to dispel also some treatment myths. So currently, many people on social media and the like, that there's, a lot of misinformation that's going around. And so I wanted to let you know that the following medications have not been shown to have any benefit in treating individuals with COVID-19. So hydroxychloroquine, ivermectin, colchicine, antibiotics, vitamin supplements or vitamin infusions such as vitamin C, D, and zinc. None of these things have been shown to have benefit in the treatment of COVID-19 infections right now. So let's shift now to talking about COVID-19 vaccinations. So currently, the FDA has authorized the use of the following vaccines. So Pfizer, it's 22 doses, 21 days apart, 95% effective. There was full FDA approval for individuals 16 years and older, and emergency use authorization for individuals 12 to 15 years of age. You're considered fully vaccinated if you're 2 weeks post the second dose. And recent data has shown that the Pfizer vaccine can be effective against the Delta variant. The Mrna vaccine is 2 doses, 28 days apart, and it's 94% effective. The emergency use authorization for and has an emergency use authorization for individuals 18 years and older. And you're also considered fully vaccinated if you're 2 weeks post the second dose. The Johnson & Johnson vaccine is one dose and is effective against any kind of severity of COVID infection, and then 85% effective for those with severe and critical COVID infections. This EUA was for individuals 18 years and older, and you're considered fully vaccinated if you're 2 to 4 weeks post the first vaccine. So how do these mRNA vaccines work? So what happens is that scientists generated the sequence that codes for the virus. So mRNA is called messenger RNA. So it, as the name suggests, it delivers a message. That message is then coded around with a lipid coating, which is fat. And then that is then subsequently, injected into the body. What happens is the cells read the information in that messenger, in that message, and that produces millions of copies of the spike protein, which you've probably seen on multiple images of the coronavirus. Those protein fragments then turn on your immune system to produce what we call antibodies, which are these pink, in this cartoon, these little pink things here. And those antibodies then protect your body when a real virus enters your body. And so that's how the virus is made. The Johnson & Johnson vaccine works a little bit different in that it uses adenovirus, which is a type of virus that causes the common cold, but it's not able to replicate. And the adenovirus carries a gene from the coronavirus into the human cells, which then produce that corona spike protein, but not the virus itself. And that spike protein, again, is what primes your immune system to fight off infection. The word about the Johnson & Johnson vaccine was, as everybody knows, in the spring, the CDC and FDA paused the administration of the vaccine after reports of a rare and severe blood clot in some individuals. And then several weeks later, the CDC and FDA recommended to resume use of the vaccine. But they did give just a caveat. After reviewing the available data, they have said that women younger than 50 years of age should be aware of the risk of blood clots with low platelets after vaccination. So that's really the group that we saw the risk of blood clots for those that had low platelets. So in those patients, then they would recommend other COVID-19 vaccines. A word about booster doses. So initially in August, the CDC had recommended people with weakened immune systems or those that are immunocompromised should receive an additional dose, a third dose of a messenger RNA COVID-19 vaccine, so either Pfizer or Mrna after the initial 2 doses. And then we talked about that the FDA granted full approval for the COVID vaccine on August 23rd. Johnson & Johnson also reported that their vaccine showed persistence of the antibody response about 8 months after a single dose vaccination, and that a booster dose further increased a person's antibody response. And then in August, we saw many people, many states, employers, cities start to implement vaccination mandates. In September last month, the CDC put forth booster dose recommendations, and they said the following group should receive a booster dose of the Pfizer vaccine only at 6 months after completing the primary series. And those are people that are 65 years and older, residents who are 18 years and older who are in a long-term care facility, and people ages 50 to 64 with underlying medical conditions. Then they also put a following grouping for those that may receive a booster dose. So those that are 18 to 49 with underlying medical conditions, and you can see these underlying medical conditions on the web. And then people 18 to 64 years of age who are at increased risk because of their occupation or that they're in an institutional setting. So what are those underlying medical conditions? They're listed here, but they're the common chronic conditions: cancer, chronic kidney disease, chronic lung disease. I'm not going to read the entire list, but it's the common underlying medical conditions. And then in terms of booster, for those that are working as frontline healthcare workers and other occupations that put people at higher risk. These include first responders, educational staff, so teachers, support staff, daycare workers, food and agricultural workers, manufacturers, corrections workers, people that work in the post office, public transit workers, and grocery store workers. We know that this list may be updated in the future. Other considerations is that we are awaiting the arrival of the approval for booster doses for those that receive Mrna or Johnson & Johnson vaccines. Currently, the approval is only for Pfizer vaccines, so just want to remind people about that. We also don't know about interchanging between vaccines. Right now, the recommendation is that you should receive both doses of a series should be completed with the same vaccination product. So if you got Pfizer for your first dose, you should get Pfizer for your second dose. Or if you got Mrna for your first dose, you should get Mrna for your second dose. More data, we're waiting additional guidance also about for those that got the Johnson & Johnson vaccine, should they get a Pfizer dose or Mrna dose. So currently, we have not received official guidance on this. Late in September, we also heard promising news from Pfizer. They released their top-line results that from their phase 2 and phase 3 trial in children 5 to 11 years of age, and it showed that the vaccine was safe and well tolerated and showed a robust neutralizing antibody response. They earlier this week they submitted the data to FDA and other regulatory agencies for review, and a review date was set for October 26th for the FDA to review the Pfizer's data. The data for children less than 5 should be expected later this year. So this is a big development for our children that are 5 to 11 years of age. And then last week, the CDC released a health advisory that, COVID vaccination is recommended for pregnant people and those that are recently pregnant, so just gave birth, and those who are lactating. We know that vaccination rates for pregnant people still remains low, and non-Hispanic Black pregnant women have some of the lowest rates of vaccination coverage. So only 15% of this group have received the vaccinations. We know that if you're pregnant or recently pregnant and you get infected with COVID, you're at increased risk of having severe illness that may require hospitalization, ICU admission, mechanical ventilation, and illness that may lead to death. We also know that neonates, so newborns born to people with COVID-19, are also at increased risk of admission to a neonatal ICU. So we want to implore those that are pregnant or that recently became pregnant for them to get vaccinated. All of this should matter to you because COVID, as you know, has been disproportionately impacting Black and brown communities. And we also know that because those that have gotten infected from COVID, they may not have been able to go to work. And so that has led to loss of income. We've noticed increased food insecurity, increased housing insecurity, depression, anxiety. And so we need, a solution to try to get us back on the road to recovery. And we know vaccination is one solution to help us to get back to the road on recovery. So I want to just flag for you that tomorrow there'll be a pop-up vaccination at Pilgrim Baptist Church from 10 a.m. to 4 p.m. So please, if you have not gotten vaccinated, please come out. Please let your family, friends know, and to come out and tell someone. We were remiss in terms of talking about, COVID without also talking about the rising numbers of individuals with depression and anxiety, particularly as we're going into the holiday season, where that frequently becomes a time where some people may feel, sad and depressed. We've noticed since the pandemic has started that there's been a rise in the proportion of adults who have symptoms of anxiety and depression. So close to 41% of adults have, and this number continues to rise, and we see it also in children and teens. So there are many resources that are available, such as the Guidance Center in Westchester, New York City Well, if you're in New York City, New York State Office of Mental Health Emotional Support Line, the National Suicide Prevention Line, and the Domestic Violence Hotline. I want to say a word about the influenza vaccine, because the annual flu vaccine is available. You're probably starting to see commercials about this, but everyone 6 months and older should get it, with a few exceptions. If a child is 6 months to 8 years of age and didn't get 2 doses of the flu vaccine prior to July of this year, they will need to get 2 doses weeks apart. And you can get the COVID-19 vaccine and the flu vaccine at the same time. So now we're going to shift to shattering a few myths. So some frequently asked questions are, can I get COVID-19 from the vaccine? No. The vaccine contains no live virus, just instructions that teach the cells how to make the spike protein so the body can help develop antibodies to it. Does the vaccine change my DNA? No. The vaccine adds a piece of RNA into that cell to instruct the cell to make the spike protein in addition to all the regular proteins that it makes. Are there microchips and nanotechnology in the vaccine? No, there are no microchips or nanotechnology in the vaccine. Does the vaccine interfere with fertility? No, the vaccine helps make spike proteins, and the immune response to the spike proteins has no effect on fertility, but will protect anyone who's immunized from getting COVID-19 should she get pregnant. Will I get charged for the vaccine? So no, you can't be denied the COVID-19 vaccine if you do not have insurance. However, some sites do charge a fee for administering the vaccine. So please, you want to double check that when you're, depending on where you're going to get the vaccine. So now we're going to pivot to your questions and see what questions we have. Pastor Washington, do we have any questions?
We're currently watching the chat. We don't have any questions at this moment. I think, Dr. Oyeku, I think you've been thorough in a lot of the questions that have arisen for us over the vaccine and over its validity, over its, I want to say, the issues present in our community that people often talk about, you know, the various things. I mean, from the spiritual end, you know, I've discussed some of these things, you know, with people who have declared to me that, you know, this vaccine is the mark of the beast or things like that that I've heard in and around the community. But I think that you really answered the medical questions here tonight in your presentation. We don't have any questions in the chat, but I do want to ask this. Because this is one question that I've heard often. In so much as a person is vaccinated, and because part of what the challenge for a lot of people is the long-term effects because we don't have enough data, as they say. Could you talk a little bit about can you hear me?
Can you repeat the part you said, the long-term effects?
The long-term effects of the vaccine. I've heard a lot of chatter about not having enough information compiled to really make them desire to be vaccinated. And so if you could just talk to us about long-term effects, and really more so about how long the research has been around for doing this type of work with vaccinations.
So it's a good question. So I think the technology or the approach that was used to create these vaccines has been around for a while. And so this wasn't something that just was created last year. The framework in terms of, and the technology that was used was something that they were already studying and had been applying to other viruses. So that was why they had a bit of a head start in terms of creating the vaccines. We already know, and you know, I have several colleagues who were involved in the clinical trials themselves. So they were doctors who decided that they wanted to be part of the clinical trials as of last year. So we have more than a year and a half of data in terms of those people who participated in the initial trial starting last year. And so far, the long-term follow-up data has not showed any increased risk of, chronic illnesses or anything like that. We do know that having COVID puts you at risk for these long hauler symptoms and these long-term complications. So, but we've, definitely this question about long-term effects of the vaccine is something that's still being explored, but we have close to, just under 2 years of data. And so far, the individuals who have been vaccinated, they have not showed increased risk of any chronic illness or disease. And I think I would say to people, like, if you want to weigh the risk of getting COVID and having long-term complications and possibly hospitalization and death, I would probably err on the side of getting vaccinated.
Yeah.
Absolutely. Ms. McCall, did you want to add to that anything?
Other than I completely agree. I think you have to, again, we're putting tools in our toolbox. So today we got a whole lot of tools, or tonight. And you have to really look at the benefits and the risks. To me, when you look at the risk of getting COVID versus the vaccine, there, to me, is no choice. Because predominantly in our communities of color, folks that come down with COVID have a very difficult time. So I think it's best if you really look at the tools you were given tonight, make some good, sound, now educated decisions. And if you are ready, come and see us tomorrow. We got a team, a great team from VIP Star. They'll be out there tomorrow and they can give you your vaccine. And there'll be a doctor there too who can answer some questions if you still have more questions or still not sure. But the goal of tonight was to give you some tools so that you can arm yourself and your family with good information. The issue that's going on out there, particularly with social media and the press and the this and the that, is a lot of noise, and it's so hard to figure out what's right and what's wrong, which is why we put together this type of a roadshow, so that you could hear from doctors and hear from professionals and understand about the vaccine, what it does, and get good information as opposed to bad information. I do also want to stress that if somebody asks you for your insurance card, you are not getting charged for the vaccine anywhere in New York State. If they ask you, it's so that the insurance company can charge an administrative fee, the vaccine person can charge an administrative fee to the insurance company, not to you. So I just wanted to make that very, very clear. And also, come visit us tomorrow if you have questions about insurance. We will have an assister there to answer your questions as well. So I think you've got some really good information, and hopefully we'll see you tomorrow. Any questions on anything?
I do have one question on the floor, Ms. McCall. Hold on one second. Sister Sonia Rogers, you can ask your question now.
Good evening. Two questions I have. What is the difference in asymptomatic symptoms? And the second question is, what is the long-term side effects? Like, what side effects would you get if you had asymptomatic symptoms?
If you were, so I think you're asking concerning an asymptomatic carrier.
Or
You're muted. That.
Yeah, probably, because I think asymptomatic by just the term itself means that without symptoms, meaning that you've tested positive for COVID, but you don't have symptoms of COVID. So you don't have the high fever and the body aches and the chills and the fatigue and the headache and all of that. It's just having, had the virus. So there's a proportion of people who test positive, but, don't really have symptoms. We saw that, with with children last year, we definitely saw that. In the adults, there's a small subset of adults that's there. In terms of long-term risk, it's a good question of being in, being asymptomatic but having COVID. That's a good question. I don't know the answer off the top of my head. I'd have to research it and get back to you, to be frank. Because most of the data that has been shown in terms of long haulers have been people who have had symptoms and then, just ended up having protracted symptoms. But I will look into that and then send that to Pastor Washington.
The second question.
Mm-hmm.
What is the long-term side effect?
Side effects of
COVID, or even asymptomatic COVID?
Well, that's what I was saying. I don't know the answer to the question. I don't know the answer to the question about what is the long-term effect of being asymptomatic, and just having COVID. If your question is, what is the long-term effect of being asymptomatic and having COVID, I don't know the answer to that off the top of my head. So that's why I was like, I would have to look that up. Was that the question?
yes, she said yeah.
Yeah.
So that was the question. And as soon as she gets the answer, she'll get that to me, and I'll make sure that I provide that information to you.
Yeah.
Okay. Was there another question?
Good question.
People are starting to get lackadaisical, because when it first hit the population, everybody was wiping down everything. Now people are starting to just not wipe down nothing. You can see smears on doors and door handles and doorknobs and gas pumps and everything. They're just letting their guard down, and it's really scary. You don't know what to expect.
Yeah, I think that's why, it seems like the obvious low-hanging, and feel free, Marcy, the low-hanging stuff in terms of washing our hands and using hand sanitizer is key. I know people think really, but that's a very important public health mitigation kind of strategy, is just washing our hands and using hand sanitizer, because there's so much that's just on the various surfaces.
I also want to make another statement. I came in, so I'm sorry that, but I do want to make another statement that it was just said today, me and somebody else was talking, and we were saying that when COVID first came out again, everybody that hit the hospital was sick, whether they had a heart attack, it was COVID. They just named everything COVID, and from what I heard, I'm not sure how true it is, that because it's COVID, that the hospital gets special funding.
That the hospital is what? Missed the last part.
Special funding, like money, okay, you got so many patients have COVID, but the patients really didn't have COVID. They just maybe came in as a heart attack or whatever, or something cold or whatever. I don't know. Yeah, but I'm just saying, but the young woman and I were having a conversation today.
Well, I don't think that any of us can comment on hospital situations. At the end of the day, the bottom line is this virus is here. And we have a tool in our toolbox that can keep us out of the hospital. With this Delta variant, there's a very good chance that if somebody gets it, they will wind up in the hospital. And that's where you don't want to be. So you have some tools. You have masking. You have hand washing and using hand sanitizer. I'm the big proponent of washing hands, and I always carry hand sanitizer with me.
So
I always wear a mask.
so
And
as
then the biggest tool is your vaccine.
I'm vaccinated. But as children, we were taught to wash your hands, and you know, we didn't do masks, but we always were supposed to wash our hands before eating, after eating, whatever. So, but my other question is, what is the Delta variant? What are the symptoms? Where is it like a spinoff of COVID, or what is it?
I didn't hear the question clear. It's just something about the.
What is the Delta variant?
So it's a type of COVID virus. It's just a variant. It's a mutant. It's a mutation of the virus. So initially we had one strain of the virus, and then it's mutated in different locations. So it's a COVID vaccine, but it's mutated and it's changed. And so this particular strain that initially showed up in India, it first showed up in India, and then subsequently in December of 2020, and then showed up in the United States in March. But a variant is just essentially a mutation of the virus. And so it has mutated several times. We've kind of gone through a lot of the Greek alphabet, quite frankly. So we started off with alpha, and then most recently we're up to M, which is mu. And stuff. So hopefully we're not going to go through the whole Greek alphabet during this time, but it's a mutation.
What are the symptoms?
Huh?
What
Symptoms.
are the symptoms?
It's the same symptoms of regular COVID. So high fever, chills, body ache, headache, fatigue, nausea, vomiting, loss of taste, loss of smell. Let me see, I may have this slide here. The concern with Delta is that, and I apologize for people's eyes, the concern with Delta is that it is more transmissible than other strains of this virus. So as I showed earlier, hopefully this shows that the Delta variant spreads easily in indoor spaces. So if you have somebody who's unmasked and then they have Delta, in this particular case, this person was an adult who was unmasked, and then they were around children, and 12 of the 24 kids subsequently were infected. So that's what's concerning about this, is that it's very transmissible, and particularly has a predilection for people who are unvaccinated. Trying to find the symptoms slide. Here we go. These are the symptoms of COVID-19. So some people have had all, some people have had some. It's not something to be wished on anyone.
Just want to welcome Dr. Isela Askew has joined.
Thank you, Dr. Askew, for joining.
Thank you. Thank you for having me.
So I think that when what we're looking at even here, it's pretty much the same symptoms that most people were feeling last year as this virus took hold of the world. As I look up and down the list, much of this is what many people whom I've talked with were feeling when they had their battle with COVID last year. And so I think it's pretty much the same symptoms. As far as a Delta variant, it's just that the Delta variant is a much more rapidly moving disease through the body. But it's just a variant of COVID-19. It's still COVID-19. It's just one of the many variants that have come out. And as they said, we've gone through many letters of the Greek alphabet to this point, and we're up to mu now?
Yeah, mu.
Okay, so we've got the mu variant.
Right. Variant, yeah. We're at mu.
And so, yeah, Yeah, which,
I have a question. So how do you know, so if you get these symptoms and you go see your doctor, the doctor will test you and they will determine whether you have regular, quote unquote, regular COVID or you have the Delta variant. So there's a test.
So it's a good question. So when you're doing the testing right now, so you know, the testing is, you know, a nasal, you know, a swab in the nose. And what they're going to test is if it's in the office testing, they're going to just test if you have COVID. To be able to determine what type of COVID you have, like what variant you have, that is a more specialized test. And so that that's not done in every single, like, it's not done traditionally in doctors' offices. It's done in specialized labs, because essentially what you're doing is you're looking at the actual virus to see what particular mutation strain you have. So not every lab does that. So most people will just know if they have COVID or not. But to know if you have a particular variant, that is a more specialized test that gets done. The presumption right now, because as you can see in this graph, is that 99.8% of the cases in the United States, like when, you know, of the specimens that have been tested, are Delta. So most state health departments are presuming that that it's Delta. And then they do random surveillance of the specimens to see if there's any new variants that are emerging. So they started to monitor for mu, because that was something that was picked up in Colombia, and then, you know, started to see, okay, let's do some analysis, and that's how they were able to identify the mu variant. Does that help?
yes, it does. It does. I think that you all have done an amazing job kind of helping us to break through some of the misconceptions, misnomers, but also to fully inform us here tonight as we are in the town hall virtually, and some who are in person. I'm grateful to God for each and every one of you. Any final thoughts, any final thing that either of you wish to say? I know Dr. Askew kind of joined us late, didn't know if he wanted to say anything, but I would like to give him the opportunity to, and any of our other panelists who are on, if you wish to have anything to say at this time, we're going to ask that you do so.
Thank you. I'm not quite sure what I missed, but just in past interactions with groups, we've really stressed prevention, obviously, with the wearing of masks, with social distancing, and with hand washing. And as we talked about a lot of the differences in the mask and the efficacy of different masks, one of the things I just want to really stress for people, the social distancing, the mask, and the hand washing are important. But if we put you in a spacesuit and you came out of that spacesuit and then failed to wash your hands or came in contact with surfaces and then touched a mucosal surface on your own body, then the best mask, the best care in the world wouldn't make a difference. So it really is almost like the triumvirate you really need to engage. You need to wear the mask and wear it appropriately. That means no sagging under your chin, like I see a lot of people doing, because then you're just touching potentially infected surfaces. So appropriate wearing, social distancing when possible, but good hand washing, covering all the surfaces of your hand, especially before you eat or touch any portion of your face, is really important.
Great.
Thank you so much.
I do have one other question that just came in from the back. I think that the delay in us being here together now live versus what's going out on social media, maybe about a 15, 20-second delay or so. So I do have one question from the back. If you could go ahead and ask that now.
This question is from Facebook Live from Mary White. Why is there not more talk of persons knowing their antibody status / level, both post or pre-vaccine? I can repeat that if needed. Why is there not more talk of persons knowing their antibody status / level, both post or pre-vaccine?
Let me make sure I understand the question. Why isn't there talk about antibody testing?
Well, people's antibody counts, either pre or post vaccine.
Okay. Dr. Askew, you want to take that one, or Dr. Suzette?
Dr. Askew, you can go ahead. I think the question was, I think it seemed like I'm just looking, why is there not more talk about people knowing their antibody status or their level, both pre and post vaccine, right?
Right. I'm not sure I'm fully understanding the question, but one of the things I've been looking at just recently is why do we need the booster in terms of people beyond 65 or people who are in highly compromised areas. One of the things that they really stressed in some of the articles I read lately is that we know that there's a decrease in the antibody count that occurs even when we've had the double Pfizer injection, and that's why they're recommending the third one. We don't know how that drop-off occurs in terms of, it's not something that happens linearly where we can make a prediction or that there's any correlation between what is a safe level of antibodies and what is protective. So as I understand this, or what I would think about for myself and what I would tell my patients, I don't want that to somehow become a false sense of security, because when I talk to some patients, even today, they're telling me that I don't need to follow the safety precautions anymore because I've gotten the double vaccination. And so I just wouldn't want the public in this setting where there's so much waiting that's either based on political beliefs or so many other beliefs that are non-scientific. I wouldn't want to impart some false sense of security by stressing something that I'm really not sure we really understand the correlation between protection and antibody levels. The best advice I can give is to protect ourselves as if we didn't know those things. And again, stressing mask wearing, obviously having the vaccination, keeping our distance, and just good hygiene. And then that actually has weighting as it extends to other communicable processes, even the typical seasonal flu, which is something that we should not forget based on the fact that it has certain lethality, especially in the extremes of age. So I don't know if I answered that question really, but I don't think there's a direct correlation, and I would not want it to somehow supplement just good safety measures and taking the vaccine.
Yeah, I definitely agree. And I mean, I can share my personal story. Like I, had COVID last spring, and was pretty sick for a while. I wasn't hospitalized, but I was quite sick, and had the lingering cough and all of that. And then as soon as I could get the antibody tested, I did, and so I had antibody levels. And then once it became available for healthcare workers, our term came up to get vaccinated. Because many people were like, well, why are you going to get vaccinated if you had COVID? And I said, no, I'm a healthcare worker. I'm on the front line. I want to get vaccinated. So I got the antibody testing just before, just to really more so to address this question that kept coming up for folks. And to my, surprise and shock, my antibodies were gone. So sometime in between that, 8 months, 6-7 month period, the antibodies had abated. And so for me, I think one, it was definitely instructive for, family members who were like, oh, you have COVID, why are you getting vaccinated? Because I was like, I don't know when I lost those antibodies, but sometime in that period I lost them. And so nobody's getting their antibodies checked every single day. So you don't know when you're gonna lose that protection. So, for me, I think your best protection is getting vaccinated. We know what this virus can do. It's over 700,000 people lost their lives. That's something, not seen the likes of. So I tell people, like, when you see the amounts of death and disability, this is not something to play with.
Right. I just saw something recent, and it's probably not even accurate anymore. They said 1 in 500 Americans. When you think about it, from a setting like that, 1 in 500,000 Americans passing due to this it's staggering.
I have a question.
There's some.
Just going back on the whole history of COVID, we know it kind of came up to some of us as a surprise towards the end of 2019 and then became a big thing towards the full 2020. From a history standpoint, how long ago has this been discovered, known, talked about, researched before this became an actual pandemic for those who like to know the facts history-wise of it? There's a lot of conspiracies of, seeing the word COVID on products, hearing the word about the COVID and SARS, things like that. So just for those who like to go history-based, can you guys give us a little background on that before 2019? And is there possibly, a follow-up to this COVID-19, COVID-20, COVID-21, and so forth?
It was hard to hear your question. Can you just repeat the question portion?
Can you give us a little bit of a timeline regarding the COVID-19 research and just being out to the public? I think a lot of people are stuck on it starting the beginning of 2020 and the ending of 2019, but what is the history and research prior to 2019?
So I think the question is, what's the history prior to when it got here? Was there any history? I mean, we've had other SARS viruses.
Thank you.
Can you give a little bit of detail on that for some that may not understand what SARS was and is today?
I'd have to let one of the doctors answer that if they can. History of SARS viruses.
Yes, let me share. Let me just hold on a second. I'll see if I can share my screen just to show you the timeline. Hold on a second. Just of other SARS outbreaks. Hold on one second.
I think just trying to understand the history of SARS and sort of, where they came from and how they developed.
Yeah, this one is a novel virus. I mean, there have been other types of SARS prior to this particular outbreak. And so there were other types of, having a brain fart, and I apologize. There have been other types of SARS virus prior to this. I'm just trying to see if I can pull up the graphic just to show you in terms of the prior outbreaks. So just if you want to give me a moment, sorry.
Absolutely, Dr. Yeko. Thank you so much. I think that's going to be an important thing to share with our community, because oftentimes when these things come up, we just assume that, oh, this is the first time we've seen this, not realizing that there have been other instances where this virus has existed. And so not necessarily in this form, but other instances where it has seemingly existed. So I think that would be helpful for our community here tonight.
Yeah, I'm just trying to see if I could find the, I had this before because this question came up before. Let me just see, figure. So there are, just in terms of, to clarify for you, in terms of SARS, just means severe acute respiratory syndrome. And that's just it's a viral respiratory disease. It's typically associated with the type of coronavirus. And so we've had, these SARS-associated COVID coronaviruses since, February 2003. This particular one that we're seeing now, this is the reason they call it novel is because it's new. So it was a mutation or in terms of the prior types of coronaviruses that we saw. And so let me see if the sharing of the screen situation works. Let me share screen. Be nice, technology, give me 2 seconds, sorry. So hopefully you can see, hopefully it came through.
Yes, we can.
Polio.
Mm-hmm.
Huh.
So
Wow.
just in terms of like when I said the first kind of severe acute respiratory, so SARS is severe acute respiratory syndrome, and that's and so there's the first one, COVID-1, like we saw it as early as 2003. It was more so in China, if I'm remembering correctly, and so then they sequenced that particular gene. They have been doing clinical trials, during this time. So there was no vaccine during this period of time. Then you had MERS, which is another variant of this, and so this was sequenced in 2013, and then there was subsequent outbreak in 2014. They did clinical trials, no vaccine. Then we had this situation that happened. So the first cases or clinical cases started to be described December 2019 with the novel coronavirus. The gene was sequenced pretty quickly in January. And so because of these prior kind of trials where they were kind of start and stops, and I didn't talk about Ebola because a lot of the technology that was used to create the vaccine that we have was based on some of the lessons learned from trying to create the vaccines for these other types of viruses. So they were able to create the first batch of the COVID-19 vaccine in February. Because they quickly were able to sequence the gene. And so then the first clinical trial started in March. So the lessons learned from these prior outbreaks and clinical trials set the stage for them to be able to develop the vaccine quicker, because you see that this was 17 years, 6 years. So people think that, oh, this just happened and this just came. This was prior years of research that then came to bear that they were able to apply to this particular virus.
It's amazing.
So hopefully that helps. So I know, and it's hard to kind of explain some of these complex kind of, virology and in words, but I think the thing is that many people get hung up with how do they do it so fast? Part of it is that they learned the lessons from the prior times and then were able to apply that to this virus and thankfully come up with a vaccine. But if you see that they had gone through several other iterations and weren't able to develop a vaccine, and then they were able to kind of learn the lessons to be able to get a vaccine sooner.
So my question is, why didn't they have a vaccine for the prior viruses? I don't think I understood you to say that. You said SARS and Ebola.
Yeah, I'm going to say in full disclosure, I'm not a virologist, I'm not an infectious disease specialist, so I don't want to kind of, say, huh?
That could go for anybody on the panel that may know.
No. I'm just saying in terms of the nuance, in terms of why, technically saying why one didn't work to the other. I don't want to say why it didn't work. they had gotten very close in terms of developing that technology to use like messenger RNA with some of these other viruses. And they were very close in terms of being able to make those successful vaccines. And then this happened. So it's not like they abandoned doing the research. The young lady, Kazmikia Corbett, she had already been doing, this type of research before. And then this happened and they were able to kind of pivot what they were working on to work on this particular virus. But what actually happened, I'd have to go to honestly look at the papers to see what failed with each of those trials. And I don't want to misspeak about that. But Dr. Askew, feel free.
And something I think we can't overstress, this is the novel coronavirus. A lot of, even from bacteria to viruses, a lot of how they work is very specific. We use the lock and key model a lot of the times to say, what component of some protein do we exploit to gain entry into that virus, or how we decide to attack it. It's new based on each virus. We take that knowledge and we apply it, but until we can find that specific lock and key model, it's very difficult. I think another thing that led to how rapidly we address this virus, though, is shared knowledge. In a lot of the things that go on, especially in the medical world, there's significant financial gain associated with medical breakthrough. So these things are frequently protected trade secrets. So when something this significant happens, though, and it has a global impact, a lot of the top brains in these areas come together and they share their data. So even a lot of the things that we learned about virus migration, virus movement, in the beginning of this, I was looking at some of the Japanese research when they did these really eloquent wind movement models, and they found out that even opening a window and creating some air movement affected how the virus affected us. So I don't know, again, if I addressed that, but just because we have this generalized knowledge, until we encounter a virus and see how we exploit it to really attack it, it really is like battle. We have to find the weak point of that virus, and then we exploit that, or we teach the body to be prepared for that type of an attack, and so we can defend ourselves appropriately. So it really is quite complex.
Thank you so much, Dr. Oyeku. Thank you so much, Dr. Askew. Ms. McCall, we really appreciate you. I thank each and every one of you for gathering here with us tonight. I don't think there are any more questions or concerns. We haven't seen anything come across our social media, but I do want to say this. I think that one of the things that, as we even look over the last 10 years, I mean, every year it seems like Apple comes out with a new iPhone. Right? Every single year, Apple comes out with a new iPhone. And that's just a reminder of how fast technology is progressing, right? Yeah. Which is also a reminder to us of how much the medical field has progressed just in the past 10 years as well. And so I think that's an important point to note, that we're able to get there faster because of some prior research that was done. We're able to provide better care and better medications and vaccinations to help people. And so I just want to say this to everyone who's on tonight. If you can, if you have not been vaccinated, if you know family members who have not been vaccinated, please send them our way tomorrow. We will have a pop-up vaccine site here at the church, 80 North Franklin Street, Nyack, New York, the Pilgrim Baptist Church on the corner of Franklin and High Avenue. Please come out from 10 a.m. to 4 p.m. You will have an opportunity to receive your first shot for your vaccinations, your first dose, as well as those who require boosters. As I understand it, we'll also be providing booster shots for those who fit into those particular categories, if I'm correct. And so if you have the opportunity, get here tomorrow between 10 a.m. and 4 p.m. We'll be providing vaccines, first dose vaccines, and you'll be assigned your follow-up date for your second dose, as well as those who need boosters. It's going to be a great day. We'll also have other healthcare providers here, discussing and talking with you about some of the other issues that pervade our community. One of the reasons that that coronavirus has done such damage in our community is because of the comorbidity that exists. And the reality that we have a lot of underlying conditions within our community that we need to seek medical help for. And so we'll be providing some of those services tomorrow where you can speak with the healthcare professional and hopefully get the help and get the aid that you need for all of your healthcare needs. I want to say this from the Pilgrim Baptist Church. Thank you all to all those who are gathered, online and in person. Thank you all for being present. To all of our sponsors, the Star Network, the Grace Baptist Church, Walmart, New York State Health. Thank you so much, Ms. McCall, for helping and aiding in this effort. The Congress of National Black Churches, CVS Pharmacy. We've had a lot of people to band together to pull this together really quickly. And for this, I am grateful to each and every one of you. And so we want to say to all of you tonight, if you have family members, please make them aware of the information you've gained here tonight so that we can make better and more informed decisions about our health and about our future as a people. May God bless you. May heaven smile upon you. And you all have a great night. Bye-bye.
Thank you. Good night,
Thank you, everybody.
Good
Good night.
Good night. Thanks again. Be well.